Yeah, that's right. So indeed, it's our great pleasure to walk you today. So we just prepare some slides, but just let me know when you have questions, or we can stop anytime for the discussion. So I try to speed up a little bit because I have a very long meeting. I can talk endlessly to my colleagues for a few hours. So basically, I'm picking up.
Are we recording and sharing?
Yeah, we are recording that. Yeah. Myself is a developmental behavioral pediatrician. We have actually a big team of around 50 colleagues working together in Hong Kong University in collaboration with the different departments. So today I would just like to make use of some of our previous learning from our early childhood intervention project to look at how early childhood intervention can effectively improve the health and the well-being of our young generation in longer run. So myself started my training and also my work as a clinician. So working in teaching hospitals and also used to work in UK for a while. I only started to join the academic field around 13 to 14 years ago. So by that time, actually, it's mainly because I find too much work related to my clinical practice. Some are developmental pediatrics, some are those child maltreatment, as you mentioned. There are so many things that just a clinician actually is not able to handle in great details. And I'm looking for those direction and then the potential evidence-based interventions that can help to improve the practice in longer run. So that's why I paid much attention and then joining Hong Kong University again and finally become a clinical professor in recent years. So we have been working on closely with our partners elsewhere in the world, not just confined to Hong Kong. Recently, actually, I worked very closely with my partners with the different cities in mainland China, in Asia. And subsequently, Claudia would also update you because I work for a different Lancet projects. So recently, I'm coordinating a Lancet commission study on ADHD. So we have been working with around 40 countries globally, and then looking at the different important dimension and the burden of ADHD. So we actually look after our children in terms of the eco-biopsycho eco-social model. And so probably realize a child was being grown up not just by himself, but of course also within the family and also the peers, the schools, and also the community. Now, so that's why in our clinical and also our research work, we are not just focusing on the health and nutrition, which we believe will be the fundamental component. But on top of that, we also think quality education, sufficient stimulation, family functioning, in particular, facing children with adverse childhood experience like child maltreatment are always one of the key dimensions. Now, I want to use some examples of our earlier work that we worked together for UNICEF. This is one of the UNICEF Best Award project what we got around 10 years ago. We work very closely with our partners from education, social science, and also in the different faculties to develop a new scale called EAP-ECDS, East Asia Pacific Early Childhood Developmental Scales. And as pediatrician, we particularly input not just confined to the developmental abilities of children in the East Asia Pacific region, but also looking at the different dimensions, including the cognitive function and then the health, well-being of our children. We measure about the growth and also the physical fitness of the kids in the different parts. Because of the blessings, the project is working with UNICEF, so we'll be able to work with the government of the 7 places directly and got a rather representative sample. We have actually published a series of the work. When you type East Asia Pacific Early Childhood Development Scale, you would see a list of papers, including some in Lancet Child and Adolescent Health and some in JAMA. Just some of the studies, for example, for these studies of over 7,000 children in the preschool age, we actually measure about the body weight, body height, and the nutritional status of the group of children. Basically, you can tell there has been a very diverse distribution of the growth abilities of our children. Some of them have got really big problems with developmental delay. Some of them got stunting, and then some of them got obesity. But as you can tell, actually, it varies quite a lot, from a little bit better performance in many parts of mainland China, but to over 50%, for example, of developmental delay in some of the less developed countries in the East Asia Pacific region. Now, what we found is the early childhood development actually had got a very strong, almost linear relationship with stunting and the body height, as well with the body mass index of the kids in the region. But for the body fat, we have a very interesting association. There's a non-linear correlation, and I will show you some of the work that we did afterwards. In fact, we have published some articles in JAMA that were open with regard to the nutritional status and the development of kids. Now, basically, when we categorize the growth of the children into the different categories, not just confined to those with overweight and high body fat, but also including those with wasted and low body fat, and also those groups with a normal body weight but with low body fat. Now, what we found among this group is that low body fat seems to be a very important single factor within those wasted population and also within those normal weight population. It would have a strong association and prediction with the developmental profile of the kid. In fact, we found similar trend also in the cognitive, linguistic, and social emotional development. And those early developmental delays were much more common in children with low body fat percentage. So it is some of the very interesting findings that we work very closely with Fred at the moment, and then published a series of work in JAMA Developmental. And you probably realize our brain is something determined, of course, by the genetics, but it is something not really static. After birth, the brain and the structure can actually be changed. Not just the function, but what we have found all these years is that even the structure of the brain can be programmed by the social emotional relationship and by many of the environment which can change the genetics. We find actually the brain is growing rapidly, starting from the newborn stage of around 300 grams. Now, 300 grams, because myself is a pediatrician, I used to do a lot of standby for preterm babies. So in Hong Kong, the quality of the preterm care are quite good. We resuscitate successfully most of the 24 weekers. So when we go to the labor ward, 24 weekers is something like my palm size, 500 grams. So 300 grams is roughly this size. And I just always remember the precious experience of successful resuscitation of some 25-weeker, and then they finally grow up to become a very successful university graduate. And just fortunately, I am also the officiating guest of the graduation ceremony and give the scholarship to those 24-weekers. So such a wonderful experience. But just also tell us that actually the newborn brain can be increasing quickly, almost 3 times the size within the first year. And the early development actually means a lot because of the synaptic connections that were built up in the first few years, actually signified what would be a child was being growing up. For example, during the critical sensitive periods at the very beginning, starting from the binocular vision, and then the habitual ways of responding, and then the symbol learning, and also the subsequent language, and the different sorts of cognitive function, most of the time those sensitive periods were being developed quickly within the first few years. So any adverse events that damage the development of the brain within the first few years usually could result in very detrimental long-term effect. So we could actually interpret how a child is being grown up in a transactional model, not just in a biological well-being, but also the continuous interaction with the environment. And now we know how a child was being turned out to be is actually the outcome of the continuous transaction between the biology and the environment. Now, you probably realize that we are facing stress every day when a child is grow up. We have positive stress facing examination. As medical students or clinical practice, we need to face a lot of positive stress, which help us to improve our performance. But most of the time when we are facing increased stress, for example, passing away of parent, which is an extreme stressful situation to a young child. But most of the time, if there's sufficient buffering, those stress to be tolerable. But we also have different sorts of toxic stress, like child maltreatment, sometimes can be sustained and then needing to break down of the nervous pathway. That's why in the past we understand from the earlier ACE studies that those significant obesities at the very beginning can impact the development of the child in longer run. For example, in Bob's previous studies already showed developmental delays can be very prevalent among those with the early childhood adversities, like those children coming from the poor families, history of family violence, and also maybe often with parents with substance abuse. It is not just affecting the developmental delay, but also increasing the chance of having major adult depression, as well as even physical illness like adult heart diseases. Now, the long-term impacts of adverse childhood experience, not just confined to the early phase of toxic brain injury, but also, as you know, with the increasing prevalence of mental health problems, and then with the subsequent physical and mental health, including those risky behaviors in long run. Professor James Chapman is one of my mentors. He works for a lot of huge economic projects and one of the Nobel Prize laureate in economy in Chicago. Middle is Professor Nermal Rao. Fred will know Nermal very well. We work very closely in various projects concerning about the education and development of kids. Now, one of the major achievements of Professor Chapman was actually to identify the investment return of our generation at a different age group. This is a life skill formation, one of the foundation work of Professor Chapman's team. Actually, we showed early childhood investment, roughly talking about for every $1 of investment, there will be at least $16 return. When I met Professor Chapman recently in the International Child Development Conference in Beijing again, actually we talked about this study. Because this study actually was being done by Professor Chapman's team earlier, they are actually chasing up a cohort of children for almost 40 years. And early childhood intervention has shown to be one of the most effective ways in prevention of major cardiovascular and metabolic diseases, including ischemic heart disease, stroke, diabetes, and hypertension. Now, I'm a member of some of the Lancet working group. Now, one of our earlier work actually is working on how the nurturing care environment can help to promote cognitive development of children in different parts of the world. As you probably tell, of course, health and nutrition are important, but in comparison, we need comprehensive programs together with quality parenting and stimulating education program, that comprehensive program, in order to achieve the optimal development of our kids, particularly in those in underdeveloped. This is some of the recent work that we collaborate with our partners. For example, Professor David Watford from Cambridge is one of our close partners. So we have organized a conference together with them 2 years ago, and Fred was also there. We actually have been talking on with the different topics, including when we visit the Trinity College, actually we share many of our experience. Now, basically, this is how our team are approaching in our research and clinical service. We are using a holistic child health and developmental perspective, not just confined to physical health, but also the mental well-being, in order to improve the cognitive development, emotional maturity, and social competence of our kids. This is one of the major cohort that we start more than 10 years ago. I remember Fred actually had been involved at the start of the project. So we visited those poorest children and then the relatively middle class children in Hong Kong, starting from the kindergarten stage. And the young lady, the scholar next to me is Professor Magdalena Yanes from McMaster University at that time, but Magdalena had moved to UBC recently already. Yeah. Then we worked together using the initial early childhood developmental tool called EDI, Early Development Instrument. And we modified and then modified into a Chinese version of CEDI. And we use the CEDI to assess all those young kids in the population and then chasing up them in the past 13 years. So what we found in the kindergarten stage is that socioeconomic gradient in the school readiness of Chinese preschool children actually was very obvious. Low social class family children, they have much lower school readiness to start with. When we do a path analysis, there have been two main reasons. Around 35% of the reason is in the family, mainly because of the poor parent-child interaction. And then 1/3 is in the school. Because of those kindergartens and the school to start with, they had much worse teaching experience, and then the facilities were rather insufficient. So what Hong Kong children, our local Chinese facing, if they are coming from the lower income families, they actually are suffering from a double jeopardy because their parents are much less likely to have good insight, and they usually have much less quality parent-child interaction. They have overuse of electronic device at the very beginning, and they have much lower chance of entering into a good and stable kindergarten. So we analyzed all those different factors together with Professor James Chapman, and what we found among those factors, including the household income, education levels of parents, and then the parental job, we find the single most important factor is parent-child interaction. The quality parent-child interaction almost at a linear relationship with the school readiness of the kids. So for those with much better parent-child interaction, the school readiness were also higher even they come from a low-income families. So we have published our work in the different journals. For example, we work on the sleep duration, particular sleep deprivation, which has been a very common phenomenon in Hong Kong, affecting the school readiness of our preschool children. We find an almost linear relationship, unfortunately, for those who sleep in the kindergarten stage less than 8 hours per day, their school readiness were much, much lower. Particularly for those sleeping less than 7 hours, they would have a lot of problem in their behaviors, emotion, as well as their learning abilities. Sleep deprivation actually is affecting the different dimensions of child development, not just in emotion, but also in language and the different interactive skills. Parental role is particularly important because we find if parents have been involved, for example, they supervise the use of the electronic device, they avoid the putting of this device in the bedroom, actually can result in a lot of marked improvement. Why is it so important? Now, because we know in the preschool stage, there has been a lot of skills, in particular the executive function, EF, was something that would develop to let a child to plan, focus their attention, remember instruction, and manage the multiple tasks together. But what we found that during the development of executive function, it involved the working memory, inhibitory control, and the flexibility in their cognition. But the brain started to develop those executive functions at the very beginning in early childhood and will continue with all those functions into the adolescent and adulthood. So you can tell, basically, the quickest period of executive function maturation were in the preschool stage, somewhere between 3 to 6 years old. So that's why all those deprivation and all those trauma making to a child during the early childhood preschool period actually would linger out into the primary school stage and then with a long-term effect. For example, our longitudinal studies already show early sleep deprivation among our Chinese children in Hong Kong would increase the risk of ADHD. Not just talking about the symptom, but also the chance of having turning up in hospital and also the chance of receiving ADHD medication. Now, in Hong Kong, one of the privilege which Claudia will have time to explain a little bit further. We have a very good electronic system throughout the population. So we can check the record of every kid being followed up in the different hospitals and then the medication they are receiving. In our record linkage, actually, we look at their diagnosis and also look at the prescription. Now, what we found is that for those kids who actually had sleep sufficiently, for example, during the preschool stage, 11 to 12 hours every day, it is the most important beneficial protective factors to prevent or minimize the risk of ADHD in longer run. But for those with more significant sleep deprivation, the risk of ADHD were much higher. And also during the preschool stage, physical activity is so important. For those with physical inactivity during the preschool stage, the risk of ADHD and having different sorts of behavioral problems were also much increased. Now, when our kids were graduating from kindergarten into the primary school stage, at around 8 to 9 years old, we found their abilities of learning in terms of mathematics, in terms of Chinese language, actually have been worsening. Now, the gap between the poor and the rich were even more prominent than what we observed at the very beginning. So this is actually in the opposite of direction of what our education experts expect, because all our education experts are expecting education can help to narrow down the gap. But what we are seeing in Hong Kong, the gap actually is widening when they're entering into normal education. Now, when those kids are entering into their teenagers, we visit them again, and then doing some direct assessment in our hospitals, and also checking their eyes, their physical abilities. Now, we found those kids after growing up, if they come from a lower socioeconomic class, actually their physical fitness, their vision, and then their long-term health were much more impaired compared to their more wealthy counterpart. Two reasons. One of the initial reason is because of the overuse of electronic device in the kindergarten stage. Secondly, also lacking of recreational parent-child interaction at the early childhood. So these are the two single most important factors that would affect the subsequent health development. We have worked very closely with the different partners, for example, with our partners in the WHO. Actually, in the guideline being issued by the WHO working group, there are three most important lifestyles that would affect the development and learning of our kids. First of all, of course, will be the physical activity levels. We require at least 60 minutes of moderate to vigorous exercise every day on average. Secondly is the screen time. Now, you know that most of the screen time that we are using now in Hong Kong and many parts of Asia or the Western world. Our kids in Hong Kong, when they are talking about 7 or 8 years old, they usually at least spend 4 hours every day on screen. But for those older group, maybe up to 6 or 7 hours. And at the same goal, sleep deprivation, quality of sleep are equally important. So in the past few years, actually, we have been working on the population level, looking at how overuse of electronic device will be linked up with the risk of ADHD. Unfortunately, what we found is that the overuse of electronic device is so prominent among Hong Kong children, it actually increased the risk of ADHD, not just from the research perspective, but also from the clinical perspective. We find this overuse of electronic device, particularly on gaming, would deteriorate the behavior of the kids in general. And then also the risk of ADHD will mark increase with the continuous increase in the time of video gaming. But parents' guidance, this is the blue line, is with parental guidance, is one of the most important beneficial factors that can protect our kids from the increased risk of ADHD. And also what we have found is the parent themselves is always one of the key problems. Hong Kong parents actually, they themselves were grown up in the Z generation. They actually had spent a lot of time on electronic device themselves before delivering the kids. But after bringing up their kids, actually, the parents have been distracted due to the high technology and then spend too much time and not much time in interaction with the kids, resulting in increase in the psychosocial problems among their children and reduced parent-child interaction and a marked increase in screen time among their children as well. So that's why we think there's a lot of good intervention that would be helpful. This is actually one of the foundation projects that Fred had invented over a decade ago. This is a sport-based youth development project. This is RCT trial in the underprivileged schools in Hong Kong using sports mentorship coaching. Now, what we have done, we go to the school and then we train up the mentors who most of them are college students. After the training, they go to the schools and then to play with the kids after school for around 18 sections. So among those sections, we randomize the kids into different groups according to their preference in the choice of the sports. And finally, what we found, of course, we find there's an improvement in the fat composition, reducing obesity, improved in physical fitness and physical activity level. But the most promising result is not just confined to the physical fitness. It's basically in the improvement of the resilience and then the strengthening of the mental well-being of the kids joining this program. And we also found the risk of having attempted suicide has been much lower after the positive mentorship program. So in Hong Kong, we found child maltreatment, as some of you mentioned, is something so important. Actually, I'm helping the Hong Kong government to pursue with a mandatory reporting on child abuse regulation in recent years, which have been implemented in Hong Kong already. So all those professionals, if they have identified risk of a major child maltreatment, no matter they are medical professionals, they are school teachers, or they are social workers, they will have a legal responsibility to report to the police and also to the central registry. Now, we find child maltreatment in Hong Kong actually have been worsening very much in the past 10 to 15 years. And we also find there's a very peculiar trend of child maltreatment hospitalization related to parental stress during examination season and also related to the family dysfunction. Now, one of the work that we recently did was on the long-term impact of child maltreatment. This work actually has involved Fred and many other collaborators globally. We found among a group of around 30,000 subjects in Hong Kong using a case control approach. Those kids with the early child maltreatment actually have been suffering from a lot of major mental health problems, including ADHD, conduct disorders, and personality disorder as well. So recently, we have been working also on the field of suicide and the deliberate self-harm, which have been markedly linked up with the early child maltreatment. This is one of the studies that we are going to publish in JAMA Level Open. Fred actually is the corresponding author. We're working on this in the past 19 years, collecting the samples of those subjects. Now, what we found is that child maltreatment is associated with most of the long-term health problems. So we classify the long-term health problem into 16 dimensions. Almost 13 of them were found to have different problems. But one important finding is that early diagnosis and timely treatment of the mental health and the brain developmental disorders before 16 years old can be the most effective way in reduction of the long-term risk of illness in childhood following child maltreatment. So that's why, along with our earlier studies published in Nature Mental Health, which show that early identification of ADHD is the most effective way in preventing child maltreatment. Reduce almost 40% of the risk of child maltreatment in Hong Kong. Because in our hospital setting, we found very commonly child maltreatment children, they also suffer from ADHD. and not diagnosed properly and not receive any treatment. Effective treatment could reduce almost 40% of those child maltreatment risk. So this is the Nature Mental Health paper. If you're interested, you're welcome. We have been this is basically my team during the COVID time. We work really closely with our partners in Asia, in Harvard, and also we work with Cambridge, Toronto, Sydney, Australia, and many of our partners in the Asia region, in particular in mainland China. So
Thank you so much. I mean, this is just incredible work. I mean, it really is. I mean, we've been kind of reading some of your papers from afar, but you're putting empirical data to what many of us as clinicians have been concerned about. I mean, interestingly, I was speaking to a senior policymaker in Scotland just last week and saying that exactly what you've shown, that if we can reduce the kind of burden from ADHD, would probably reduce child maltreatment significantly.
Yeah.
And people are so shocked by that. They don't realise that there's a link. So, I mean, just can't thank you enough for this incredible work. Questions?
I have a couple, if I may. So one's for Professor P. You were saying before that there was, first of all, it's amazing, like all the work you're doing and considering all the data you're collecting and the rigor you're putting into it, and really fascinating from a data perspective and what can be done with those data. I was curious to understand more about the association that you found between hours of sleep in early childhood and also phone use and gaming, and then ADHD, because I think you mentioned that this might be not maybe causal, but could be causal. But I'm wondering if it's also could be like a diagnostic spy for ADHD. So if you did some use of GWAS study as well to see if there was overlapping with genetics patterns that are mostly associated with ADHD or other neurodevelopmental conditions.
Yeah, thank you so much. And indeed, you have highlighted a very important point, because we even though we are suspecting there would be a lot of reasons why early environment can increase the risk of ADHD. But actually, most of the study, we do realize that there have a different source of limitations and the potential confounders and the bias. For example, even though we try our best to do it in a longitudinal way in a cohort, but obviously there would still be other factors besides deprivation, besides overuse of electronic devices, and like genetic factors that you mentioned may also accounting for why the risk of ADHD have been increased in that. Even though we have the luxury of being able to linking up some of the research data and then the clinical data together, we will be able to present the picture in a little bit more comprehensive way. But sometimes it's also still a bit difficult to control some of the potential limitations. For example, you can realize when we are talking about the causative mechanism, obviously that would be far from the conclusion, because the causative effect is usually biological, even though we find it to be possible, because the mechanism, particularly affecting the dopamine system, like how physical activities training, like intervention, because we know that physical exercise can definitely improve the dopamine neurotransmission, which is very similar to the effect of psychostimulant like methylphenidate. So that's why we believe some of the intervention like physical activity training sometimes can actually do benefit to those subjects with ADHD. That's something that, yes.
No, I'm sorry, I didn't mean to interrupt you at all.
Yeah.
I just had a related question. Because I was wondering about things like parental working hours. Because I mean, I've been struck clinically that short sleep is often really a noticeable feature of ADHD. And I'm just wondering in these families who are struggling to help their children to sleep with ADHD, Are they challenged by, for example, holding down more than one job or that kind of thing? Do you have any data on things like parental working hours?
Now, Helen, you are an expert, and then you can actually teach us more about what are the sleep disturbance that ADHD children are usually suffering from. As you could realize in work class, for example, that you mentioned, because in our management of ADHD children, we always find sleep disturbance is a common phenomenon. Even for those without starting treatment, the sleep disturbance is very common. But for those starting with treatment, sometimes sleep disturbance can be a side effect. So it is quite tricky. But the merit of having a cohort study like that is because we can assess and follow up the child early enough before the occurrence of those ADHD symptoms. So ensure the early stage of sleep deprivation may be probably one of the determinants. But Helen also highlight a point that because the parents actually themselves are also involved in the home mechanism. As you probably realize, because ADHD runs in families, so for those parents of kids with ADHD, they may already themselves suffer from ADHD or suffer from other sorts of mental health problems. So it would make the picture much more complicated. Helen just mentioned about the parenting data. We do have some data starting from the early stage of the parenting intervention, but we are still building up because the kids that I just show you, they are now in Hong Kong. They are now starting to study primary 4. Primary 4 in Hong Kong, we're talking about 10 years old. So we start the intervention at around 5 years old, and now they are 10 to 11 years old, around 5 to 6 years time. So we hope we could actually accumulate a little bit more data in order to have a more accurate prediction of how the parenting early intervention can make the difference in terms of the ADHD risk afterwards. And concerning about your very good suggestion about the genetics factor, we do collect the biological samples in a different cohorts. For example, I just talked with Fred yesterday. We have a large, we haven't presented, we have a larger blood cohort starting from pregnancy in Hong Kong. We were commissioned by the government to examine the vitamin D status of pregnant women and the children. So we make use of that opportunity with their consent. We also collect the DNA and the blood of the mother, and also we collect the cord blood of the baby after delivery. At the very beginning, we examined the vitamin D level, which showed vitamin D deficient is very common and got a very good correlation between the maternal blood during pregnancy and the cord blood of the baby. But we also collect the DNA in order to understand more in the future about the telomere length, because we study a lot of telomere shortening, which I have not presented today. And we also, in our cohort that I just mentioned, we also collect some of the DNA. But the problem is that it is very resource driven. So we don't have enough amount of funding to do all those genome sequencing for the time being. We hope we can apply for more funding to do that, but we have collected the blood in order to have a better understanding about the situation.
Perhaps I will supplement a little bit because
Yes,
I helped analyze the data back then. So the core study had adjusted for parent and teacher rated ADHD symptom at the time. So if sleep deprivation or sleep duration is a part of the symptom, it's one of the first symptoms that occur in early childhood, and also adjust for SES, including occupation. So kind of similar level of occupation.
And do you remember, Fred, whether you had working hours at all?
Not working out directly, but they're say manager versus manager and working part.
Yeah. I'm so sorry we've unfortunately run out of time, but this has been just absolutely fantastic. Would you be willing for us to actually have your slides? Could you download your slides?
Sure.
That would be amazing, because I think there'll be other people in the team really keen to have a look and listen to the presentation.
You can share the slide and also show our video recording. Yeah.
Thank you so much. I'm really grateful for you taking the time to come and talk to us. It's been wonderful, and I hope we can keep in touch and maybe build some collaborations. That would be fantastic.
It's a great pleasure to be able to meet you this morning.
Thank you so much. Thank you very much.
Shall we take a photo together?
Let's do that. Let's do that. I wonder if we can even. Come on, everyone, let's get the picture. I wonder if I could actually lean this somewhere and
Do the timer.
do a timer. Yeah. Oh my goodness.